Hello everyone, welcome you all to the 9th free session of Movement Maestro Academy on this year 2022. Like all the sessions, the process of receiving certificate of this session is mentioned in the description section. You all can follow and achieve the certificate. Today, we are going to discuss on the topic, the pulmonary system and exercises. For this session, we have our resource person, Dr. Manisha Saha, who is working now as an assistant professor at Gayatri College of Physiotherapy, Odisha, and as well as she is working as an online teaching faculty at Movement Maestro Academy. So without wasting our time, let's start today's session. Over to you, Doctor.
Thank you, Dr. Pradyut. Let's start with the session. Today, our topic is the pulmonary system and exercises. So let's know about what is pulmonary system first. A pulmonary system is also called respiratory system. Then what is respiration? Respiration is the process by which oxygen is taken in and carbon dioxide is given out. So this is the normal respiration process. So what is the normal respiratory rate? That is in adult 12 to 16 per minute. So again, the types of respiration is two types, external respiration and internal respiration. What is external respiration? That involves exchange of respiratory gases between, that is respiratory gases is oxygen and carbon dioxide between lungs and blood. Then what is internal respiration? Internal respiration is that involves exchange of gases between blood and tissues. This is the two types of respiration, external respiration and internal respiration. Then what we call inspiration and expiration. What is that? That is the phases of respiration. Inspiration and expiration are the phases of respiration. Then what is inspiration? It is the inspiration during which air enters into the lungs from atmosphere, and expiration is during which air leaves the lungs. This is called normal breathing, and what we call is respiration. That include during normal breathing. Inspiration is an active process and expiration is a completely passive process. So let's start. So under these headings, we are going to discuss about pulmonary systems and exercises. First is introduction, then we can study a little bit about respiratory systems, anatomy and physiology, then pulmonary ventilation and energy demands, how the pulmonary ventilation and energy is required for the body during activity, then respiratory adaptation to training. Training means during any physical activity, how the respiratory system get adapted in our body. Then effect on respiratory system, what are the changes occurs in respiratory system during physical activity. So when oxygen supply depends only on diffusion through skin, it would be impossible to support the basal energy requirements. So earlier it is only depend on skin, then the respiratory system get involved in it and the basal energy requirements get fulfilled by that. The remarkably effective ventilatory system meets the body's need to maintain efficient gas exchange, that is oxygen and carbon dioxide gas exchange between alveoli and lungs. This system regulates the gaseous state of our external environment from which we inspire air and aerating fluids of the internal environment during rest and exercises. What are the major functions of the ventilatory system? That is supply oxygen required in metabolism through inspiration, eliminate carbon dioxide produced in metabolism, that is expiration, and regulate hydrogen ion concentration to maintain acid base balance. So these are the three major functions of the ventilatory system. So what is our ventilatory system, or what is ventilation? Ventilation or respiration is the same process in which air enter into the lungs and carbon dioxide get exhaled out from the air. Then air enter or leaves the lung. That is normal respiratory physiology. So again, ventilation is divided into pulmonary ventilation and alveolar ventilation. What is pulmonary ventilation? Pulmonary ventilation is the volume of air moving in and out of respiratory tract in a given unit of time during quiet breathing. That is called pulmonary ventilation. Again, what is pulmonary ventilation? It is the volume of air move in and out of the respiratory tract in a given unit of time during quiet breathing. That is called pulmonary respiration. That is also called minute ventilation or respiratory minute volume. So it is a what is pulmonary ventilation? It is a cyclic process by which fresh air enters into the lungs and the equal volume of air leaves the lungs. Then again, alveolar ventilation. Alveolar ventilation is the amount of air utilized for gaseous exchange in every minute. That is the difference in between pulmonary ventilation and alveolar ventilation. Remember, the ventilation is the rate at which air enters or leaves the lungs. That is called only ventilation. That is a respiratory physiology or respiratory cycle that continues. That again divided into pulmonary ventilation and alveolar ventilation. Pulmonary ventilation is the volume of air moving in and out of respiratory tract in a given unit of time during quiet breathing. And alveolar ventilation is the amount of air utilized for gaseous exchange in every minute. So that is the difference in between pulmonary and alveolar ventilation. So let's know about some respiratory system or respiratory tract. What is respiratory tract? So the air moving in and out of the lungs, and how it moving in and out. From the respiratory tract starting from nose and it enters into larynx, pharynx, then epiglottis, glottis, then it enters into trachea. From trachea, it bifurcated into two branches, that is called bronchus. And in each bronchus enter into individual lungs, that is left and right lung. Then bronchus is again divided into bronchioles, that is primary bronchioles, secondary bronchioles, tertiary bronchioles, and finally the terminal bronchioles. And in terminal bronchioles, the alveolar duct are attached. Alveolar duct, in each alveolar duct, the alveoli are attached in it. So this is the structure of respiratory system or respiratory tract. It is again divided into upper respiratory tract up to the lungs, up to the starting from nose up to the trachea, then lower respiratory tract from trachea to lungs, that is the lower respiratory tract. This is the exact structure how it looks. Larynx, trachea again divided into bronchus, left bronchus, right bronchus, left bronchus, right bronchus again divided into primary bronchi, secondary bronchi, and tertiary bronchi. Again, bronchi are divided into terminal bronchioles. In each terminal bronchioles, the alveolar duct are attached, and in each alveolar duct, the alveoli get attached, which is the structural and functional unit of the respiratory system, that is the alveoli. So here you can see the alveoli. Between alveoli and the capillary, the exact gaseous exchange can happen. Oxygen can enter into the blood vessels, and the carbon dioxide from the blood vessels, it can enter into alveoli, and again the carbon dioxide is exhaled out from the body. This is the process where alveolar gas exchange occurs. So what is the mechanism of respiration or mechanism of ventilation? It is inspiration and expiration. Then how the inspiration occurs and how the expiration occurs throughout the body. So during inspiration, what happens? The diaphragm contracts. It is the muscles. When contracts, flatten out and moves downward up to 10 centimeter towards the abdominal cavity, and this enlarges and elongates the chest cavity. So when during inspiration, when air enter into the lungs, what happens? The diaphragm contracts and flattens out and moves towards up to 10 centimeter towards the abdominal cavity, means downwards, and this enlarge and elongate the chest cavity. This force can help to elongate the chest cavity. When the chest cavity elongate, the air in the lungs that expand and reducing its intrapulmonary pressure to about 5 mmHg below atmospheric pressure. And what is intrapulmonary pressure? It is also called intra-alveolar pressure. And it is the pressure existing in the lungs on existing the lungs of alveoli. So that is the, it is negative during inspiration and positive during expiration. So it can reduce the intrapulmonary pressure, so the air can easily get into the lungs. So this is the difference, the pressure differential between the lungs and the ambient air literally sucks air in the through the nose and mouth and inflates the lung. So due to this pressure difference between the intrapulmonary pressure and the atmospheric pressure, the air can easily enter into the lungs. So it inflates and store in alveoli. So the degree of lung filling depends on two factors: the magnitude of inspiratory movements, the magnitude, once the magnitude is increased, when the increase, the inspiratory movement also increase, and the more air enter into the lungs. Then again, the pressure gradient between the air inside and the air outside the lungs. So these are the two factors when the lung filling during inspiration. Then what is expiration? Expiration, it is predominantly a passive process, occurs as air moves out of the lungs from the recoil of stretched lung tissue and relaxation of the inspiratory muscles. So what is inspiratory muscles? Inspiratory muscles are the muscles that involve in inspiratory movement, that is called inspiratory muscles. So what is an inspiratory muscles? The primary inspiratory muscles is diaphragm, which is supplied by phrenic nerve, and external intercostal muscles, which is supplied by intercostal nerves. The two main muscles of inspiration is diaphragm and external intercostal muscles. The accessory muscles of inspiration is sternocleidomastoid, scalene, anterior serrative, and elevators of scapula and pectoralis are the accessory inspiratory muscles that help in inspiration. Then same as expiration, what is expiratory muscles? The primary expiratory muscles are internal intercostal muscles, and the accessory expiratory muscles are abdominal muscles. So these are the muscles that help in inspiration and expiration. So what is expiration is totally a passive process during which the recoil of stretched lung tissue, that is the alveoli, and relaxation of the inspiratory muscles. So when alveoli move out of the lungs and from the recoil of stretched lung tissue, that already air moves out to the of the lungs. This causes the sternum and ribs to swing down while the diaphragm moves down towards the thoracic cavity. So what happens in inspiration, the lungs get expand, and what happens in expiration, that is the ribs and sternum get swing down, get relaxed, and the diaphragm also relaxed and moves towards the thoracic cavity. When inspiration, what is the position of the diaphragm muscle? It moves towards the abdominal cavity, and during expiration, the diaphragm moves towards the thoracic cavity. And these movements decrease chest cavity volume and also compress alveolar gas. This forces it out through the respiratory tract to the atmosphere. So in this way, the carbon dioxide get exhaled out from the body. So during ventilation in moderate to intense exercises, the internal intercostal muscles act powerfully on the ribs and abdominal cavity to produce a rapid and greater depth of exhalation. So what is the main muscles of expiration? That is internal intercostal. So that helps act powerfully on the ribs and abdominal cavity to produce a rapid and greater depth of exhalation. So it can help in more in exhalation process. So what happened during inspiration and expiration is the air moves into, during inspiration, the air moves into the lungs, and during exhalation, the air moves out of the lungs. So what are the changes occurs in that? During inspiration, the enlargement of thoracic case occurs. Now, when the thoracic case enlarges because of changes all the diameter, the transverse diameter, anterior posterior diameter, all transverse diameter, vertical diameter, and anterior posterior diameter also get changed with that. Then what in also that increase in elevation of the ribs. So what is the anterior posterior and transverse diameter of thoracic case are help in increasing the elevation of the ribs, and the vertical diameter is increased by the descent of the diaphragm. These are the most important diameters that are during inspiration. What happens? It enlarges the thoracic case. The thoracic case enlarges because of the increase in anterior posterior, transverse, and vertical diameters. What is anterior posterior, transverse, and vertical diameters? What are the rules of it? Anterior posterior and transverse diameters increase the elevation of the ribs, and vertical increase the elevation of the ribs, and the vertical diameter is increased by the descent of diaphragm. These are the difference. Then in general, when the change in thoracic cavity occurs, there is movements all over. The movements occurs in the lungs and also in the sternum, also thoracic case, and the upper costal and lower costal series. So the sequence was the movement in thoracic case, upper costal series, lower costal series, and diaphragm. These are the changes in size occurs in during inspiration and expiration. So when the thoracic lid increase, the diameter changes, anterior posterior diameter of the thoracic case. So due to the contraction of the scalene muscles, the first rib move upwards to a more horizontal position. This increase the anterior posterior diameter of the upper thoracic case. Then move to upper costal series. In that case, the two types of movements occurs. One is pump handle movement and another is bucket handle movement. The upper costal series means second to sixth rib. The movement happen between second and sixth rib, that is come under upper costal series. So what is happening in that? The diameter changes, anterior posterior and transverse diameter. So in that case, the pump handle movement and bucket handle movement can occur. So in pump handle movement, what happens? The contraction of external intercostal muscles causes elevation of the rib and upward and forward movement of the sternum. So this movement is called pump handle movement. So during pump handle movement, the anterior posterior diameter of the thoracic case is changed. Then again, the bucket handle movement, what happens in that? Simultaneously, the central portion of these ribs move upwards and outwards to a more horizontal position. So that's why it is called bucket handle movement. This increases the transverse diameter of the thoracic case. The next move to lower costal series. In lower costal series means 7th to 10th rib. In that case, the transverse diameter of the thoracic case is changed. And what happens in diaphragm? As you already know, movement of the diaphragm increases the vertical diameter of the thoracic case. And normally before inspiration, the diaphragm is normally in dome shaped with convexity facing upward. So what happens in inspiration? Due to the contraction, muscle fibers are shortened, but the central tendinous portion is drawn downwards, so the diaphragm is flattened, and the flattened diaphragm increase the vertical diameter of the thoracic case. So this is all about the muscles and how the movements occurs in, what are the changes occurs in lungs and its accessory structures during inspiration and expiration. So let's know about pulmonary ventilation and energy demands. How the pulmonary ventilation get affected during any physical activity. Let us know. During physical activity, increases oxygen uptake and carbon dioxide production more than any other physiologic stress. Large amounts of oxygen diffuse from the alveoli into the blood, returning to the lungs during exercise. So what happened during any physical activity is the demands of oxygen get increased, and also proportionately the demand of carbon dioxide, production. So large amounts of oxygen is when there is oxygen uptake is increased in the body, the alveoli, more amount of oxygen get diffused into the blood, returning to the lungs during exercises. Then conversely, the considerable carbon dioxide moves from the blood into the alveoli. So it is a vice versa process what is going on. This is the gas exchange process happen in between blood means capillary and blood vessels and in between the alveoli. That happens in this alveoli is the structural and functional unit of respiratory system. That means that is the cell, alveoli is the cell, then that is surrounded by the capillaries. Then capillaries are supplied by alveoli. So the blood exchange is happening in between, the gas exchange is happening in between oxygen and carbon dioxide. Concurrently, increases in pulmonary ventilation maintains stable alveolar gas concentration. So oxygen and carbon dioxide exchange proceeds unimpeded. So once the oxygen uptake increases, automatically the increase in pulmonary ventilation that maintains a stable alveolar gas concentration, and in between that is in oxygen and carbon dioxide exchange proceeds unimpeded means unhindered. So let us know the ventilation in steady rate exercises. So what happened in that is during light and moderate exercises, the pulmonary ventilation increases linearly with oxygen uptake, and ventilation mainly increases by increasing tidal volume. So in light and moderate exercises, the pulmonary ventilation is automatically increased during physical activity, but it doesn't increase linearly with oxygen uptake. And ventilation mainly increase by increasing tidal volume. So what is tidal volume? So it is a lung volume. That lung volume means these are the tidal volumes, inspiratory reserve volume, expiratory reserve volume, residual volume. These are the volumes of air that air breathed by an individual. It can be static and it can be dynamic. So what is tidal volume? It is the volume of air breathed in and out of the lungs in a single normal quiet respiration. So normally, the normal value of tidal volume is 500 ml. So tidal volume signifies the normal depth of the breathing. So what is tidal volume again? This is the volume of air breathed in and out of lungs in a single normal quiet respiration. And the normal value is 500 ml, and it signifies the normal depth of respiration. So when the pulmonary ventilation is increased, also the depth of respiration is or breathing is also increased. Then the ventilatory equivalent for oxygen represents the ratio of minute ventilation to oxygen uptake. The ventilatory equivalent is the oxygen represent the ratio of minute ventilation to oxygen uptake. Mainly the ventilatory equivalent is the measurement of ratio of the volume of gas expired per minute to the volume of oxygen consumed per minute. This is called ventilatory equivalent. So this index indicates breathing economy because it reflects the quantity of air breathed per amount of oxygen consumed. That is called ventilatory equivalent. Then despite individual differences in the ventilatory equivalents for oxygen of healthy children and adults during steady rate exercises, and complete aeration of blood takes place because of two factors. The complete aeration of blood takes place because of two factors. That is first, the alveolar oxygen and carbon dioxide percentage of oxygen and carbon dioxide remain at near resting values. And another is transit time for blood flowing through the pulmonary capillaries proceeds slowly enough to permit complete gas exchange. So these are the two factors that completely help in aeration of blood in between the lungs during steady rate exercises that happen linearly with oxygen uptake. The pulmonary ventilation increase linearly with oxygen uptake. So ventilation in steady rate exercises mean The ventilatory response to fixed level of submaximal exercise can be divided into 4 phases. So what is the steady rate exercises? During steady rate exercises, there is always increase in ventilation are proportional to increase in carbon dioxide production and oxygen consumption. So that is so in this graph. Proportional the increased production of carbon dioxide and the increased consumption of carbon dioxide. That is, we can see in this graph. The ventilatory response is to fixed level of submaximal exercise can be divided into 4 phases. Sudden increase at onset, ventilation gradually increase to higher steady rate level, and steady state level of ventilation maintained, and recovery period gradually return to resting levels. Then phase tidal volume higher than resting level coincide with exercise excess post-exercise oxygen consumption. So this graph shows that how the level of oxygen consumption and at the same time the level of carbon dioxide production during steady rate exercises. Then in non-steady rate exercises, what happen in pulmonary ventilation? It can show this like linear minute ventilation and ventilatory threshold. So what is minute ventilation? It increases in proportion to oxygen consumption over range from rest to moderate exercises. So in steady rate exercises, that is moderate exercises, what happened in that we can see in graph. And again, this is non-steady rate exercises. It indicates increases in proportion to oxygen consumption over range from rest to moderate exercises. Then it also increases disproportionately to oxygen consumption over range from moderate to strenuous activity or more physical activity. Then the point at which ventilation increases disproportionately with oxygen uptake during incremental exercise is termed as ventilatory threshold. So what is ventilatory threshold? The point at which increase disproportionately with oxygen uptake during incremental exercise is termed as ventilatory threshold. That means during non-steady rate exercises, the oxygen consumption and the rate during rest to moderate exercises, the amount of oxygen consumption and the amount of carbon dioxide production, that is depend on this graph that is shown in this graph during moderate to strenuous activity. And let's know what is the physiological adaptation to exercises. What are the changes occurs in the body starting from brain? In brain, there is increase in neurogenesis. Neurogenesis means the ability of generation of new cells in the brain. So that is happen in fetal case, in the uterine life of the fetus. And decrease in neurodegeneration. Obviously, when oxygen demand is decreased in the brain, automatically that leads to neurodegeneration and also increase in cognitive function. Then in body composition, what is happening? Increase muscle strength, increase balance, increase motor control, increase joint mobility, decrease regional adiposity. Regional adiposity means accumulation of fat in certain areas, and that also increase in muscle mass, increase in bone density. What happens in lung exactly? Increase in respiratory function, increase in ventilation, increase in gas exchange. Then what happens in heart? Decrease blood pressure, increase maximum cardiac output, increase in blood volume, increase body fluid regulation, increase heart rate variability, and increase cardiac preconditioning. Then what happens in metabolism? Always increase when oxygen demand is increased or oxygen uptake is increased in body. Metabolic rate is automatically increased, and increase in protein synthesis and increase in fat oxidation. Then what are the effects of exercise on respiratory system? So when we inhale air, that means we inhale the oxygen into the lungs. Then when oxygen is entered into the lungs, oxygen reaches blood from lungs to the body through the alveoli, through the gas exchange happening between alveoli and capillary. And at the same time, during physical activity or during rest, it can utilized by the body. So what happens during exercise? The muscles use oxygen and also increase the carbon dioxide production. Also the ATP get generated to compensate that action. So again, the carbon dioxide is enriched and oxygen depleted due to strenuous or moderate physical activity. Blood returns to the heart through superior and inferior vena cava, and oxygen pour our air to lungs and exhale carbon dioxide. So this is the exact procedure how the oxygen get move into the lung and carbon dioxide get moved out of the lungs. So what are the effect of exercise on respiratory system? It increase lung volume and capacity to breathe air, also improve blood flow to upper lobe of lungs, also improve utilization of the alveoli, also increase in gaseous exchange and improved recovery from exercises, smaller oxygen depth, and respiratory muscles get fitter and stronger. So these are the effect of exercise on particularly respiratory system. So that is all for today. Hope you can understand. So thank you, Movement Maestro Academy, to give me this opportunity to share my knowledge, and hope the student can understand it. Thank you, sir.
For sharing your valuable time as well as knowledge with us. It was really a great session. Thank you everyone for joining today's session. Good night.